Welcome, my dear friends. Myself, Professor Dr. Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's disease is a plague. Oh, you will ask, sir, why you are talking about this plague? Because these cases are not at all found very commonly in nowadays. So why you are discussing about the plague? But my dear friends, I am very sorry to say, according to the Central Council of Indian Medicine, CCIM, this particular topic is still included predominantly in the subject of Kayachikitsa, that is Ayurvedic internal medicine for the fourth year BMS students. So as I am taking some lectures for Kayachikitsa subject, this is one of the important lecture for theoretical purpose, not for practical purpose, according to me. So for the examination, even in the Viva, you may be asked, even in the written, you may be asked, because this is a part of syllabus. Myself is Professor Dr. R. Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology, that is Kayachikitsa and Kriyashari. For paid online consultation, paid online classes, you can WhatsApp me on 9226810 So my dear friend, this is the lecture regarding the subject Kayachikitsa in Ayurveda. Okay, this is the subject for fourth year BMS. According to CCIM syllabus, this topic plague has been included in paper 1, part B, point number 1. In under the big heading of fever, there are different types of fever are explained, are mentioned in the syllabus, and I have already uploaded many videos regarding these simple topics for SAQ. So please see all these my videos regarding the Kayachikitsa subject. So let us start to discuss about plague. Plague is a serious, very serious, if it is occurring bacterial infection. This is a bacterial infection which is transmitted by fleas. Remember this thing. This is known as the Black Death during the medieval times. Black Death. Today, plague occurs in fewer than 5,000 people a year worldwide. See how rarely this is occurring nowadays. Very rare, very rare. It can be deadly if not treated promptly with the antibiotics. So the patient can die. So the patient should be admitted in the hospital and IV antibiotics should be given for the cases of plague. So you can see the plague. Here you can see the rat's blood, and then it is going ahead. And this is the first step. Rat carries the plague bacteria. This is most important. Rat carries the plague bacteria. Then the fleas, and then it is coming into the human being. And then you can see the human is suffering with the plague. So this is the how plague is transmitted from the rat to the human being. Okay. The organism that causes the plague, what is the name? Yersinia pestis. Yersinia pestis. Remember this name. This may be asked for multiple choice question MCQ in the exams of MD, MS, post-graduation entrance examination. Lives in small rodents on every continent except Australia. In Australia, it is not found. The organism is transmitted to the humans who are bitten by the fleas that have fed on infected rodents, okay, or by human handling infected animals, especially veterinary surgeons. Then the most common form of plague results in the swollen and tender lymph nodes, that is called as bubo, big lymph gland swelling, bubo, in the groin region, armpits here, axilla, armpits, or in the even the neck region. So lymph gland, lymphadenopathy. The rarest and deadliest form of plague affects even the lungs, and it can spread from person to person. Now symptoms, plague is divided into three main types: bubonic, septicemic, and pneumonic. Remember these names. It will be asked in the oral viva question. Bubonic, lymph gland enlargement; septicemics, the toxins will be spread through the blood; and pneumonic, related with the lungs. Bubonic plague, most common variety of the disease. It is named after the buboes, that is swollen lymph nodes, which typically develop within a week after an infected flea bites the human being. Buboes may be situated in the groin, armpit, or neck. Size of the chicken egg. Oh, big, very big, huh? Very big lymph glands. Tender, sparsha sahatva. The patient will not allow to touch. Tender. He will get the pain if you touch it. And warm to the touch. Sudden onset of fever with chill, headache, fatigue or malaise, and muscular pain, muscle aches. Now, next type, septicemic plague, occurs when plague bacteria multiply in the blood. Fever and chill, high fever will be there. Abdominal pain, diarrhea and vomiting, bleeding from the mouth, nose or rectum or under skin. So bleeding is very dangerous for septicemic plague. Shock, patient will be go into the brain, less bleeding, blood supply. So the shock, unconsciousness. Blackening and death of the tissues, that is gangrene in extremities, hands and legs, most commonly in the fingers, toes and nose, gangrene will be there. Third variety of plague, pneumonic, related with the lung. This affects the lungs. It is the least common variety of plague, but the most dangerous. It is very rarely found, but if it is found, it is dangerous because it can be spread from person to person after sneezing, after coughing, by droplet infection. Okay, cough with blood, difficulty in breathing, breathlessness, high fever, nausea, vomiting, and weakness. Pneumonic plague progresses very fast and may cause respiratory failure and shock within 2 days of the infection, very fast. If the antibiotic treatment is not initiated within first day after signs and symptoms that first appear, the infection is likely to be fatal. The patient can die due to the respiratory failure. Causes, as I have mentioned, plague bacteria Yersinia pestis is transmitted to human when they are bitten by the fleas which have previously fed on infected animals. Which are the infected animals? Rats, squirrels, rabbits, dogs, and chipmunks. So this can be some pictures to remember. The bacteria can also enter into the body if there is a break in your skin that come into contact with an infected animal's blood. So be careful if you are having hands or the feet having some wounds. Don't touch to the animals, especially the rats. Get special precautions. Domestic cats can become infected with plague from fleas, bites, or from eating infected rodents, that is the rats. Pneumonic plague, which affects the lung, is spread by inhaling infectious droplets cough into the air by a sick animal or a person. Risk factor. The risk of developing plague is very low. Worldwide, only a few thousand people develop plague every year. This is a rare disease nowadays. However, risk of plague can depend on where the person lives, where the person travel, or his occupation, and even depends on the person's hobbies. Remember, plague outbreaks are most common in rural areas and in urban areas where there is overcrowding. Number one, poor sanitation and high rat population. The greatest number of human plague infections occur in Africa. Veterinarians and their assistants have the higher risk of coming into contact with the domestic cats which are infected with plague. Also, people are at high risk who works outdoor in areas where plague infected animals are common. Camping, to go to the camps, hunting, hiking in areas where the plague infected animals reside can increase the risk of being bitten by an infected flea. Complications. Most people who receive the prompt antibiotic treatment survive from bubonic plague. Untreated plague has a high fatality rate. A person can die if not antibiotic is given. Blood clots in the tiny blood vessels of fingers and toes can disrupt the flow of blood and cause the tissue to die. That is called as a gangrene. Tissue is dying because of the constriction of the capillaries. Gangrenous part may need to be cut, amputated. Rarely, plague may cause meningitis. Now the test, blood test for Yersinia pestis bacteria in septicemic plague. A fluid sample can be taken from bubo in bubonic plague to look for Yersinia pestis bacteria. To check for pneumonic plague, sputum or fluid is tested. Treatment, most important, is isolation in the hospital. Powerful antibiotics like gentamicin, doxycycline, that is doxy 1, ciprofloxacin, or levofloxacin. These are the different antibiotics. So, my dear friend, today we had discussed about the plague Although it is a rare, but it is a part of your Kayachikitsa subject, fourth year BMS, CCIM syllabus, paper 1 part B, point number 1, fever. There is a subtopic plague. So you must study it and you will get the full marks in SAQ if you understood this lecture very nicely. Okay. But as this is an educational video, disclaimer, वैधानिक इशारा, कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्यकीय सलाह लेना बहुत ही जरूरत है. If you are suffering from cerebral palsy, arthritis, diabetes, blood pressure, cardiac problem, MND, HD, ADHD, active deficiency, hyperactive disorder, idiopathic thrombocytopenic purpura, or any such type of chronic disease or autoimmune diseases, you definitely can come to us because I have the very good team of the expert doctors and you can get a good treatment, Ayurvedic treatment. For paid online consultation or paid online classes, you can WhatsApp me on 9226810630. I request all of you to like this video, share this video, and please don't forget to press the bell icon and subscribe my YouTube channel. I wish you all the best. Sarve Vispina Santu, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschit Dukhamapnaya. I wish you all the best. Bye bye.